Hey, newborn champions! A little yellowing after birth might seem normal, but when does it become dangerous? Today we're talking about neonatal jaundice, why it happens, how we treat it, and how nurses are key to early detection, treatment, and parent education. Jaundice in newborns is caused by elevated levels of bilirubin, which is a yellow pigment released during the breakdown of fetal red blood cells. The immature liver in newborns can't always process and excrete bilirubin fast enough, leading to hyperbilirubinemia, a condition that affects nearly 60% of term infants and even more in preemies. There are two types of jaundice, physiological and pathological. Physiological jaundice usually starts after 24 hours, peaks by day 3 to 5, and resolves within a week or two. It's a normal adaptation after birth. ABO or Rh incompatibility, infection, G6PD deficiency, cephalohematoma, or liver dysfunction. Here are some signs, risk factors, and ways to assess jaundice. Look for yellowing of the skin and sclera, starting from the head downward. Other signs can include lethargy, poor feeding, and high-pitched crying. Risk factors to keep in mind are prematurity, bruising at birth, exclusive breastfeeding with poor intake, and blood type incompatibility. So let's talk about assessment tools. First, there's the transcutaneous bilirubin meter, or TCB. This is a non-invasive way to get a skin reading. Then we have the total serum bilirubin, or TSB, which is the definitive laboratory test. And if hemolysis is suspected, you'll want to consider the Coombs test, blood type, and reticulocyte count. So let's talk about treatment strategies. Phototherapy is honestly the primary treatment for neonatal jaundice. It works by converting bilirubin into a water-soluble form, which can then be excreted through urine or stool. It's important to remember that eye protection, frequent repositioning, and temperature monitoring are all required during phototherapy. In severe or refractory cases, exchange transfusion may be used. And of course, making sure the baby is getting adequate feeding is crucial, since it promotes bilirubin elimination. We should encourage breastfeeding or formula feeding every 2 to 3 hours. Nurses need to initiate and monitor phototherapy, making sure the lamp is at the correct distance, eyes are shielded, and bilirubin levels are checked every 12 to 24 hours. It's also essential to track input, output, and weight to ensure the baby is well hydrated and having regular bowel movements. We always need to assess for worsening symptoms, keeping an eye out for signs of bilirubin encephalopathy, like lethargy, poor tone, or even seizures. Educating parents is key. We explain the purpose and safety of phototherapy, encourage frequent feeds and skin-to-skin contact, and teach them how to spot worsening jaundice at home, such as changes in the eyes, chest, or extremities. And of course, we stress the importance of follow-up visits for repeat bilirubin testing. Neonatal jaundice is common, but that doesn't mean it's always harmless. Nurses are truly essential in catching early signs, delivering therapy, and helping parents feel both informed and confident. So, what's your go-to trick to help parents understand jaundice care? Please, share below. Like, subscribe, and follow for more newborn care insights, because every baby deserves a bright, safe start.